Bismillahirrahmanirrahim. Assalamualaikum and good morning to everyone. So today topic will be preparing for exercise. When we talk about preparing for exercise, there are 3 points that you must remember, which is the first one is before, number two is during, and the last one is after exercise. And within these 3 points, you must focus on safety and effectiveness. What you should prepare before, during, and after exercise. Before we go to exercise, you must establish your medical readiness. Here are some questionnaire or tools that we can use to measure your readiness to make sure you don't have disease or sickness before you go for activity. The first one is physical activity readiness questionnaire, PACU. Everyone know about it. And the second one is ACSM risk classification categories. You can search it and find out about these 2 points. Now we go to attire before you do your physical activity or exercise. A lot of people said that your attire must be proper. Proper attire. What does it mean by proper attire? We go one by one. The first one is specific. Your attire must be specific to activity that you want to do. For example, when you go to the gym, you use gym shoes, gym attire. When you want to go to the field, for example, playing football, you must use boot, something like that. You must be specific to what kind of activity you want to do. And then point number two, your attire must not be too tight or too loose. Point number three is cloth must be porous to allow sweat evaporation. Next point is women can use exercise bra and men can use athletics footer. For example, knee support, ankle support for men. And then the last one, you can use absorbent socks. Socks must be fit properly because if it's too short, it may cause ingrowth toenail, and if too loose, it may cause blister. Why you must go for pre-participation health screening? There are some purpose of pre-participation health screening. The first one is you need to identification and exclusion of individual with medical contradiction. You must know what you can do, what you cannot do. When number two is identification of individual at increased risk for disease because of age, symptom, and or risk factor. We prepare before anything happen. And point number three is identification of person with clinically significant disease. And the last one is identification of individual with other special needs. For example, obese people, okay, they have high blood pressure. For example, they have high blood pressure. What kind of exercise they should do? What they cannot do? Fact to consider during exercise. The first one is warm up. Everyone know what is warm up. Everyone say that what is function of warm up to avoid injury, to prepare your muscle to prepare to do exercise. Okay, the explanation for all those points is the first one is prepare heart muscle and circulatory system, which is decrease irregular heartbeat and minimize premature lactic acid build-up. That is why we need to prepare before exercise. The explanation for prepare before doing activity. And then point number two there is to avoid or reduce injury. Why? Because when you stretch the skeletal muscle, before you stretch, your muscle is cold and stiff, and then after it become elastic and extensible. When it become elastic and extensible, reduce the risk of injury. Okay, next point is cool down. It is the first point that it is more important than warm up. Please do not skip your cooling down. Point number two is help relieve spasm in fatigue muscle. It will reduce your fatigue after you do your exercise. In other words, reduce DOMS, DOMS, delay onset muscle soreness. Point number three is more effective for lengthening the muscle. In other words, increase your flexibility. When you always do your cooling down, it will increase your flexibility, or you want to maintain your flexibility, your muscle flexibility. And the last point there is increase venous blood deoxygenated return. It will increase oxygenated blood in your muscle because it increase venous blood deoxygenated return. Okay, now we go to next slide. Reason for stopping exercise. The first one is systolic blood pressure (SBP) more than 250 and diastolic blood pressure more than 120. Point number two is systolic blood pressure does not rise. Point number three is severe dyspnea, difficulty in breathing. Point number four is leg cramp. In other words, you are fatigued. Point number five is lightheadedness. Next point is confusion. When you become confused, please stop doing exercise. Next is cyanosis. When we talk about cyanosis, when your lips, your arm become bluish, blue in color, dark blue. Next point is ECG irregularity, electrocardiogram, your heart rate irregularities. Next point is request to stop. When your client or you yourself request to stop, please stop. Next point is equipment fail. All of a sudden your bike, treadmill uh, fail. And the last one is when environment or situation become hazardous. All of a sudden, uh, thunderstorm, haze, anything. Next slide is exercise in adverse environment condition. Heat, in other words, hot environment. The first point here is during prolonged exercise, illness, or extreme condition of heat body deviate outside the normal range, which is 36.1 to 37.8 Celsius. Point number two is evaporation, primary avenue for heat dissipation during exercise, 80% during exercise and 20% during rest. Next point is maximum sweat rate is 1 to 2 liter per hour. And then dehydration can occur. Rate of sweat decrease. When you become dehydration, your rate of sweat will be decreases. And the last one, heat related problem. It may cause hyperthermia. Next slide is how you want to avoid all the condition in our previous slide. The first point there is limit or avoid exercise in hot or humid environment. The safe one is 32.2 Celsius. Next point is replace fluid regularly before, during, and also after exercise. And then point number three is do your exercise in the morning and evening. Next point is proper attire. And the last one is rest in the shaded at regular interval. When you have rest interval, you go to the shaded area. And the last slide is cold condition. Other condition other than heat, it is cold condition. In cold condition, the first one what you need to do is avoid hypothermia. And then next point is wear light clothing in spiral layer rather than one heavy garment. And the last one is try to keep from getting wet. I think that's all for today's slide. If you have any question related to this chapter, you may PM me. Thank you.